China's Hubei province has reported a massive spike in new cases tonight. There have been nearly 15,000 new cases in over the past 24 hours alone, the biggest single jump since the outbreak. Officials say they included cases diagnosed using clinical methods since Thursday. Another 242 people died from the virus in Hubei province in the past day. That brings the total number of deaths in China to more than 1,300. These are new pictures coming in to us from Wuhan. Authorities can be seen stepping up efforts in order to contain the outbreak. Residents there are required to report their temperature every day. People are not allowed to leave their homes unless deemed necessary by local officials. So what is life really like there right now? Joining me live from Wuhan to take your questions this morning is Chris Buckley. Chris is a reporter with the New York Times. He went to Wuhan just before the city was locked down. Chris, how are you doing?
I'm doing well. Keeping careful, being vigilant but not panicking, and watching how this city is coping with this massive crisis.
What's it like to be there?
It is, to use a cliche, it's a bit like a science fiction film sometimes. I can walk out my door in a few minutes and the streets are largely empty. This is a city of 11 million. You wouldn't believe it when you step outside. There are a few cars on the road. People can go outside to do shopping, or for brief errands, or for a little exercise. But most of the time people are staying at home, keeping to themselves, avoiding physical contact with any strangers or visitors. So it feels like a very empty city still, and we're almost 3 weeks into this lockdown.
Yeah, you've gotten to know a few people there. What are they saying to you?
It's a real mix of emotion now, but I think this sense of despondency and just waiting for this crisis to end weighs on a lot of people, especially if they have older people who they have to care for, if they have chronic illnesses, or if they have children as well. Like, as you could imagine, having a 5-year-old cooped up at home for 24 hours a day is a real burden on any family. So that weighs on a lot of people. And then there's this undercurrent of anger at the government, like, how did you let this epidemic slip out of control?
Yeah. Take a listen to a comment we got from Miguel on that point.
I'm sure that the Chinese government is doing everything they can. I just don't think it's an open society, so we don't really know. And they're very secretive about what happens. This probably wouldn't have gotten to this stage if they had been open from the very beginning. But again, we know that they have to, saving face for them is probably more important than social policy and public opinion.
Chris, is Miguel right? And how has the president been handling the coronavirus outbreak?
Well, I think the response to the outbreak has gone through several phases. And it does seem, certainly to begin with, in the initial phase of the outbreak here in Wuhan, when the virus began to spread, apparently from a fresh fish and meat market. When it began to spread from there, it seemed that city officials didn't want to hear too much bad news about this. They didn't entirely bury what was going on, but it does seem quite clear now that they put the best light on what was happening. They underplayed the risks of human-to-human transmission, and that seems to be, looking back now, a very serious mistake. What the government has been doing since then, not just in Wuhan but across China, is playing a game of catch-up, mobilizing immense resources to try to stop the spread of this virus, to keep people in their homes, to keep people in their communities so that it doesn't spread. But I think along with that very, very strong response, there's been a great deal of sometimes overreach as well. So that here in Wuhan, for example, doctors and hospital workers will tell you that it's been more difficult to get medical supplies simply because of all the road checks that people have to go through to get in. So sometimes these measures for safety can actually have a paradoxical effect of making life more difficult for people.
Our next comment comes from Julie. Take a listen.
Facebook, there's a lot of people fighting over fake news, the idea of fake news. And so there's this report that people are being told that to put their animals down, their pets, or they'll be called. So I'm trying to decide if that's just sort of alarmist.
Chris, in your reporting, and especially online, how prevalent is fake news around this topic, and how does that impact what's happening? Your reporting, for example, inside Wuhan.
When you talk about fake news, I mean, China has its own very strict definition of fake news, and in the Chinese government's eyes, what is not authorized and distributed through official government channels is called fake news. Now, what many Chinese people, including Wuhan, rely on for information is not just the official news channels, but these, especially a social media platform called WeChat, in which groups of families, dozens of people, even hundreds of people can share opinions and information. Now, some of that news can be fake, no doubt, and some of it is misleading, such as, for example, ineffective remedies or preventive medicines for this virus. On the other hand, we have seen how WeChat and other social media platforms can be a way of sharing real news as well, news that sometimes the government here doesn't want distributed.
Okay, our next question comes from Twitter. What happened to the millions right before the lockdown? Does anybody know where they went or ended up? And Chris, I think our viewer is referring to those people who fled Wuhan before the quarantine.
Yeah, I think there's a little bit of a misunderstanding about that number. You have to remember that this outbreak and the emergency happened in the days leading up to China's Lunar New Year holiday. Now, Wuhan is a large industrial riverside city, so it has a very large population of migrant workers who come from other parts of China. So it's natural during the New Year holiday, many people are going home and leaving Wuhan, leaving Hubei. So it may be that among that number there were people who were deliberately fleeing because of news of the virus, but I think the great number of them were simply people who were going back on their holidays, not knowing about the potential risks of taking the virus with them.
We're seeing the spike in cases tonight, Chris. I think something like 15,000 or nearly 15,000 new cases. If the community is in lockdown, how is it spreading?
Well, I think we do have to start trying to understand what's happening with this announced big jump in the numbers. My understanding of it, and I should say that this is a very preliminary understanding, is that there were certain numbers of patients before who were not counted in the official count of people considered to have contracted the coronavirus. And what the government has done overnight is to play catch up and say, we're going to move all of these people now into this category of confirmed cases. So it's not as if all those people were confirmed in a hospital yesterday as having the virus. It does seem to be this is a catch up on a cumulative trend, which the government decided had to be reflected in the official numbers. I think the problem now is that, as your viewers' comments have already suggested, seeing that big jump, even if it's well-intentioned, even if it's done for the best policy purposes, is going to create disquiet, especially because, as far as I can see so far, the government hasn't done a very good job at explaining and communicating what is behind that change.
Yeah. How is this virus spread? Do we know for certain?
Well, there are a number of theories around, and it's obvious that the medical experts are still trying to pin down the exact channels through which it's spread, whether it can be spread, for example, through building drainage systems and so on. But the most obvious way, of course, is human-to-human contact, and if you're up close to somebody, breathing or sneezing on them. So one of the clearest safety messages to people in Wuhan is to wash your hands regularly. And there's also a great deal of advice about wearing masks all the time as well. I know doctors have questions about whether wearing masks is always advisable, but at least it shows other people on the street that you're conscious of trying to keep them away from any potential contagions.
I noticed that President Xi was wearing a mask.
Yes, I think the whole leadership now is trying to show that it is behind this effort, is adopting some of the same safety procedures as ordinary Chinese people have to. One of the complaints among many people in Wuhan, though, is that they don't have enough masks. They don't have enough antiseptics. They don't have enough gloves. They don't have enough thermometers. And while there might be masks freely available, they don't have enough of the the best quality ones, the N95 ones, which are most effective at stopping the virus from spreading. So leaders might be wearing masks, but people here still do need more equipment.
What about food and supplies? How do people do that? How do you do that?
Well, I'm staying in a hotel, which, bless them, is still working fairly well. They just called me there, sorry.
That's okay.
For people on the street, food is still surprisingly accessible. As part of the emergency measures for Wuhan, the government has set up these channels to bring in fresh produce.
That's
Sorry
okay.
about that.
Room service.
So I can go down to the supermarket here and buy fresh fruit, fresh vegetables. It's much more difficult for certain types of people, though, for example, for elderly people who have to travel further for food and so on. The other thing you notice if you go into the supermarkets is that the instant noodle shelves are almost always empty. People might be at home, but they're often eating pretty basic, sometimes out of necessity, sometimes simply because they're feeling very tired and despondent and they just want a simple meal of instant noodles.
New York Times reporter Chris Buckley live in Wuhan tonight. Chris, thank you so much. How much longer do you expect to be there?
It depends on how much longer the lockdown lasts, but I feel it's possible to stay here being vigilant, and it's a great privilege to be among the Wuhan people.
Chris, thank you and good night. Have a good day.
You too.